Hello, everyone. Welcome to 4.1. We are talking about the first part of developing treatment plans for musculoskeletal pathologies. We have this broken up into 3 separate days because there are quite a few in your book to discuss. All right, so for today, let's talk about what constitutes a manifestation of musculoskeletal disease. All right. Usually, people suffering from this have a generalized persistent pain. They may have localized pain and tenderness during palpation, especially if they have a tender point, a trigger point, an area of the bone that is in pain. They may have pain and tenderness accompanied by crepitation. All right. Crepitus. Remember, crepitus is the noise that your joints are making during movements. There might be evidence of local or general inflammation, like swelling, heat, redness of the skin, pain, loss of motion alone, or in combination with the loss of strength in affected muscles in these areas as well. So first, we're going to talk about osteoporosis. This is a pretty common issue, and it's one that you definitely need to know about if you're going to be working on older ladies or just taking your MBLEX exam. Osteoporosis is a loss of normal bone density and increased bone porosity. All right, bones become brittle and weak and can be described as compressible like a sponge. You can squeeze them down rather than dense like a brick, and this increases the risk of fractures. A simple task like bending over and picking up a book can cause what's called a pathologic fracture. A pathologic fracture is a broken bone that's caused by disease rather than by injury. Women, especially older women, account for 80% of osteoporosis cases. Estrogen level declines. This is really important, guys. I have literally seen this question on the MBLEX. Estrogen levels decline in women during and after menopause. The decline of estrogen causes osteoblasts to be less active and osteoclasts to become more active, reducing bone density and increasing bone porosity. Bones can become so porous that they can no longer withstand mechanical stress. All right. The most common sign of osteoporosis is bone deformity, such as abnormal spinal curvatures like scoliosis, hyperkyphosis, geez, also known as dowager's hump. All right. That's when you get that hunchback. All right. And loss of height. Usually there's not a lot of pain until a fracture occurs, which of course will break in the periosteum, which is the hard outer covering that has nerves in it. Sarcopenia is a loss of muscle mass and muscle strength that you will also see alongside severe cases of osteoporosis. All right, massage and osteoporosis. You need to position the client for comfort, especially in cases of spinal deviation such as hyperkyphosis. This might include a neck pillow while they're side lying or while the client is prone. All right, consider placing a small pillow or other supportive cushion under the clavicles, right, or the upper chest to reduce discomfort from overextension of the thoracic spine. Because when they are laying prone, and their spine is humped up towards the ceiling, that weight of the body is going to be pulling it down uncomfortably. Research suggests massage using light pressure is best for clients with osteoporosis as they are susceptible to fracture from low weight external forces. Fibromyalgia syndrome. Oh, this is a chronic condition characterized by widespread pain and joint stiffness, restless sleep, and chronic fatigue. Very often, people believe that chronic fatigue syndrome is a fatigue heavy precursor to fibromyalgia, which is a pain heavy fatigue syndrome. Uh, Fibromyalgia is also called myofascial fibrositis, and muscular rheumatism. People with fibromyalgia syndrome experience pain at a lower pain threshold. All right. So, someone that has fibromyalgia might feel pain when you're pushing down at a pressure of 3, whereas someone else wouldn't feel it until you're pressing at a 7 or 8. Fibromyalgia might develop after psychological trauma, a local or general infection. Some medications will lead to this, or withdrawal from medications. Using a lot of artificial sweetener has also been tied to this, and physical trauma such as whiplash associated disorders. The most prominent symptom is pain, often described as aching, burning, or gnawing, or a migraine headache of the muscles. It frequently begins in a localized area, especially in the neck and shoulders, and then spreads and becomes more generalized. Most women with fibromyalgia say they experience pain and fatigue during approximately 90% of their waking hours. These are some signs and symptoms and clinical manifestations of fibromyalgia, with the rate of occurrence in people that were polled. So muscular pain and tender points are in 99% of the people with fibromyalgia. Mental and physical fatigue in 85%. Irritable bowel syndrome showing up in 70%. Urinary urgency or frequency in 40%. This is a pretty cool chart if you're interested in working with people with fibromyalgia. And even if you're not, even in the spa industry, you will eventually have at least one woman showing up with fibromyalgia symptoms, I promise you. So this is definitely worth a peek. Here's some research that I have included, so you're more than welcome to download the PDF or read the research sections in your book, but it is here for you for ease if you want to pause the lecture and read it as well. Myofascial pain syndrome. Now, this is a chronic pain disorder characterized by the presence of myofascial trigger points and muscular pain. Remember, a trigger point is a tender, localized hardening that lies in a palpable taut band within a skeletal muscle. You're going to feel the trigger point, okay? You're going to feel it almost like a button or a band in the muscle with a tender point in there. Strictly speaking, trigger points located in skeletal muscle and their associated fascia are called myofascial trigger points. However, trigger points can be in other soft tissues like ligaments and tendons as well. Trigger points can cause or refer pain, cause or contribute to motor dysfunction like stiffness, limited motion, and muscle weakness, and cause autonomic phenomena like a change in pallor or sweating or watering eyes. Referred pain is a pain felt in an area of the body other than its source or site of origin. One of my favorites here that's notated, I don't know if you can see my mouse circling, just inferior and medial to the scapula here, these two trigger points that are notated in the latissimus dorsi, right in the lats. Sometimes those and a little bit superior will activate in people and be very, very tender. And you can actually get referral pain all the way up into the jaw. And so when you're working on this area, especially in the subscapularis and in these lats, you can be pressing on these, and the client will start complaining about pain being wrapped up and they can feel it in their actual jaw. All right, massage and myofascial pain syndrome. What do you need to know? Consider incorporating the application of direct pressure on trigger points to improve treatment outcomes. I know that some of your courses, I have definitely included trigger point guides for you guys. Definitely check those out. It's definitely worth having some trigger point charts because it's pretty cool. Trigger points are more or less similar on most people. And of course, there are variations. Everybody's body is different, but trigger points have been mapped out fairly well. So this is absolutely something I would encourage you to learn. When deciding whether to release a trigger point between sessions with your client, try to encourage them to work on it themselves, because the more that these get released over and over, the more that they relax out. I don't want to say it's the less that you have to do later, but it is a cumulative effect. If you and your client are both working on these trigger points, your client is going to feel 3 times better versus 1 times better. It's sort of the sum is more than the total of the parts type of thing. In this case, you, the therapist number 1, and the client number 1, both adding up, working on trigger points does not equal 2, it equals 3. You want to constantly work on these to get them worked out of the body. All right, here's a comparison. I do have a lot of comparison information as well on your attendance question. From fibromyalgia and myofascial pain syndrome. Very often people with fibromyalgia will later also be diagnosed with myofascial pain syndrome, but there are some differences. Like where fibromyalgia is more generalized, myofascial pain syndrome will be very regional. All right, here's some good research information for you for myofascial pain syndrome if you are interested. Headaches. Headaches are a pain or discomfort in the face, head, or neck. They're also called cephalgia. All right, there are different types of headaches: tension headaches, migraine headaches, cluster headaches, secondary headaches. Secondary headaches are caused by conditions, disorders, or pathologies. They are not the primary source of the issue. They come about because of something like a sinus infection, an allergy, meningitis, which we've talked about before, tumors, things of that nature. Tension headaches are the most common type, and they usually have like a band or like this bilateral pattern with non-throbbing pain, ranging from mild to moderate. They don't worsen during routine daily activities such as bending over or walking. Whereas, like if you had a sinus headache where you've got pressure building up and it's caused by the pressure in those cavities, when you bend over, your headache's going to get much worse. That does not happen in a tension headache. Migraine headaches are the second most common type of primary headache, and that is moderate to severe, severe. These can last up to 72 hours and can cause things like visual hallucinations, extreme blinding pain. Most people suffering a migraine are going to want to lay down in the dark and cold and not experience any stimuli whatsoever. The cause of migraines is unknown, but researchers think at the moment that they might be related to imbalances in the brain chemicals like serotonin and neuropeptides. So it's really fascinating stuff. I do know that there is a lot of musculoskeletal correlation with migraines, things like extremely tight occipital, suboccipital muscles. There's a really cool maneuver to release the suboccipitals to release headaches and very often migraines in that area. There's also some really cool releases that you can do in the temporomandibular joint and along the temporalis and along the frontalis muscle to release some of these as well. If you're interested in seeing some modalities for headache treatments and stuff, please let me know and I will try to either make some or find some and throw some more in the class for you. So cluster headaches are pretty rare. They start suddenly and they're unilateral. All right. So they're on one side, one lateral side, usually behind the eye or in the eye region. It's usually really severe and it's usually like a burning or stabbing pain. They can happen off and on throughout the day, sort of appearing in clusters, which is why they're called cluster headaches. And then they go into remission. All right, massage and headaches. Massage for tension headaches. You want to treat your soft tissues of the scalp, suboccipitals, the posterior neck and shoulders, and you want to use moderate to deep pressure. Light pressure doesn't really do a lot in these areas, although I also highly recommend doing a light pressure scalp massage to get that aponeuroses sort of stretched out, get that frontalis, everything worked in that area. Massage for migraine and cluster headaches. It says to postpone until the client's headache has subsided. I have done ice massage headaches or ice massage, I should say, on migraine headache sufferers while they are suffering in the process, as well as doing neck work and TMJ work on them. I would say that that is honestly up to your discretion and your client's discretion, although it is advised that you do not work on them until the headache has subsided. Sometimes working on it will cause the headache to subside, depending on what is causing the headache, though. So you know yourself, and you and your client should know themselves, and you can make appropriate decisions as adults. Here's some cool research on tension headaches. I also highly recommend that you guys take a peek at the Touch Institute of Miami. If you're interested in perhaps sending out some information to doctors or a pain management clinic that work with people that suffer from chronic headaches, you can send them some of this research to possibly refer people to you if this is something that you would like to specialize in. Working with people with headaches and being able to relieve that is absolutely amazing. I would also highly recommend getting a good referral network of acupuncturists, perhaps to do some dry needling as suggested in here, or physical therapy to help them with range of motion exercises and flexibility as well, to make sure that you're really giving your client a well-rounded chance at fighting these headaches. All right, Dupuytren's contractor. Dupuytren contractor is fibrosis of the palmar fascia. This is also one of your attendance questions, causing the third, fourth, and or fifth fingers into a fixed flexed position. All right. Usually the index finger and thumb are not involved. It's just the hand. You can see in this image down here underneath my face how it starts to ball up. It seems to be related to minor trauma, maybe things like alcoholism, sometimes medical conditions such as diabetes, seizure disorders, and thyroid problems. But most often, the skin of the palm thickens over several years and then progresses to the development of longitudinal cords or nodules that you can see bulging up off of the tendons. And of course, as that cord tightens, it pulls or flexes the fingers on the ulnar side of the hand towards the palm. All right. This is pretty severe. You can absolutely massage it. It might aggravate it, though, in this case. If you sort of like rheumatoid arthritis, massaging right in that area could cause some inflammation and actually create more issues with the condition. Stretching has the best benefits. All right, slow, gentle stretching. So I would recommend extending the fingers, in this case, extending all of those tendons and ligaments in the area, and doing maybe some myofascial release in there, but definitely extension and stretching is going to be the best way to combat this when you are doing massage therapy. Bunions, hammer toes, and mallet toes. These are foot deformities in which the muscles, tendons, ligaments, and joints fail to hold the toes straight, causing them to assume atypical positions. Bunions are characterized by medial displacement and enlargement of the first metatarsophalangeal joint. All right, say that quickly 5 times. Because the tip of the great toe points laterally, all right, towards the second toe. All right, so it's going outwards. It's not medial because it's pointing towards the other toe. Medial would be towards the midline of the body, which would be outward from the foot. It points laterally, which means it actually leans in towards the second toe. Because it points that way, the toes become overcrowded. Bunions are more common in women than in men, and they're also called hallux valgus. Hallux valgus. Okay, remember that term, hallux valgus. Bunions can occur on the fifth MTP joint of the smaller toe with lateral displacement of the affected joint, called bunionettes. Isn't that so cute? The most common cause of these things are chronic irritation and pressure from shoes that are too short or shoes with a narrow toe box, like shoes that are really super cute that have like a point where the toes insert, like high heels. That's not how your feet are shaped. That's fashion killing your feet. You can also have congenital deformities, foot injuries, joint diseases such as rheumatoid arthritis, but usually it's because you've fallen subject to fashion or ill-fitting shoes that unfortunately causes this. All right. All of these foot conditions are characterized by abnormal bending with limited or painful movement in the affected joints. So you can absolutely massage people with bunions, hammer toes, or mallet toes. Just ask about sensitivity over the joint and avoid traction and passive range of motion. You don't want to aggravate these joints by moving them around too much. And since they are already misaligned, you don't want to cause any further harm by tractioning. Hammer toes occur when the MTP joint is abnormally extended, all right? And the proximal interphalangeal joint is abnormally flexed. Hammer toes occur during this in the second, third, and fourth toes. They like bend down, okay? They curve inward when that joint becomes extremely flexed. Mallet toe is characterized by an abnormally flexed distal interphalangeal joint. The second toe is the most often affected in either condition, but other toes can be involved as well. As you see, this one is hanging out here. It is sticking out, and it looks like almost like a mallet that you would see to use as a tool. Pes planus and pes cavus. Pes planus and pes cavus are congenital or acquired foot deformities causing the longitudinal arch to be abnormally flat or abnormally high. Pes planus is known as flat feet, and this occurs when the medial longitudinal arch, I'm going to say it one more time so you guys remember it. The medial longitudinal arch, which is the instep of your foot, right? It's that curve on the medial portion of your foot, is reduced or collapsed, causing the medial border of the foot to come into contact with the ground when standing. Pes planus, which is more common than pes cavus, usually does not cause pain. Oh, but it can contribute to problems in the feet, ankles, and knees. Pes planus is also called fallen arches. So this is an example here of someone with it. So is this one here. As you can see, that ankle is starting to roll. Well, what happens when your ankle collapses and rolls? It's going to cause your knee to knock outwards, which then is going to cause you to try to stabilize with your hips. That can travel and cause pain in the low back, which can cause your back to arch one way or another, depending on which side is more collapsed than the other, and eventually cause shoulder pain as well. Pes planus is definitely one of those things that can cause musculoskeletal imbalance all the way up the body because the foundation is unstable. The rest of the body gets thrown off, sort of like a Jenga block, all right? You are pulling out blocks by having these flat feet. Pes cavus is also called a high instep, as you can see here in these images where the foot almost looks completely bent in the middle. That occurs when both the medial and lateral longitudinal arches are excessively raised. This may cause the ankle to be in fixed plantar flexion, where you're almost constantly pointing downwards. Massage applied to the leg muscles may help reduce tension, and by leg muscles, they mean below the knee, especially working on those anterior leg muscles. Inquire about sensitivity over affected areas and adjust pressure accordingly. Bone cancer. Bone cancers are malignant tumors originating in and destroying bones. True bone cancers that are primary bone cancers where the cancer comes from the bone itself is actually super rare. Usually bone cancer is secondary from another type of cancer that has metastasized. There are 3 common bone cancers: this osteosarcoma, chondrosarcoma, and Ewing sarcoma. Other bone cancer types are fibrosarcoma, angiosarcoma, and giant cell tumors. All right, each one is characterized by its primary tissue type, peak age, and the bones that are most often involved. There are some tables explaining these, and we will talk a little bit more about cancers in week 6. But please know that the most common complaint, of course, is pain, which actually increases at night. These clients may experience fever, fatigue, weight loss, and anemia. They sometimes also get pathologic fracture. All right, remember that is a fracture that is caused by disease rather than an injury. You definitely want to ask them about the side effects of cancer treatment if this is a client that you are working on. And you only use hand pressures. Do not lean on these clients for any additional weight for any type of pressure. You want to use light pressure only. Paget's disease is a progressive disease marked by excessive bone remodeling, resulting in weak, enlarged, and deformed bones of increased mass. This is probably not something that you're going to see very often, if at all, in your career, but please know that it is out there. It's usually seen in the skull, spine, pelvis, and long bones of the lower extremities. People with Paget's disease can get compression fractures and osteoarthritis along with this. Osteosarcoma, um, the bone cancer, develops as a late stage complication. Almost everyone with osteosarcoma has had Paget's disease. Um, Paget's disease is also called osteitis deformans. All right. If you are massaging someone with Paget disease, ask about their most recent bone scan and know the areas of bone frailty to avoid, and only use very light pressure over these areas. Only very gentle passive range of motion and mild rocking. All right. And please be aware of coexisting medical conditions such as the osteoarthritis and hearing loss as well when you are considering your treatment plan. Osteomyelitis and rickets. So osteomyelitis is demineralization of mature or adult bones, which causes them to become soft, flexible, and deformed. They sort of crumble away like nail fungus in a nail. Rickets is osteomyelitis when it is a child and the bones are still growing. All right, osteomyelitis is adult bone, rickets is still growing bone. The main cause is a dietary deficiency or malabsorption of vitamin D and phosphate. All right. Sometimes lack of sun exposure, which would mean you're not producing enough vitamin D in the body. Prolonged use of phenobarbital for seizure control and chronic kidney disease can also cause issues with rickets and osteomyelitis. All right. Use light pressure over affected bones, which is usually in the lower extremities. You can use gentle passive range of motion, such as mild rocking in the affected areas. Marfan syndrome is a genetic disorder affecting the body's connective tissues. Although all body systems are involved, it primarily affects the musculoskeletal and cardiovascular system, as well as the eyes. Marfan syndrome is caused by a defective gene that codes for fibrillin, which is a protein found in connective tissue, which gives it its elasticity and its strength. All right, remember that one. Fibrillin, a protein, is found in connective tissue, which gives it its elasticity and strength. A reduction of this not only reduces the integrity of structures with connective tissues such as tendons, blood vessels, and heart valves, but it also causes overgrowth of bones in the body. All right. Characteristics of Marfan syndrome are tall, slender stature, and long extremities and digits. So when someone's like extending their arms with Marfan syndrome, the length of their arms exceeds the height of their body. They are very distinct. All right. There are abdominal and aortic and cerebral aneurysms are possible because you have weakening in the blood vessel walls. So be very, very careful with massage, if you feel a heartbeat in the abdomen, that could be an abdominal aortic aneurysm, possibly. And you definitely want to ask them to see their healthcare practitioner in the case of that. Depending on how severe the disease is how far you need to modify your massage. Mild cases require little modification at all. They're not going to experience any pain or any difficulty from a normal massage. Severe cases might require that you use light pressure. And again, very mild rocking and passive range of motion, as with most of these musculoskeletal disorders, where we are seeing pain or deformities in the connective tissue or in the bone itself. All right, muscular dystrophy is a group of rare genetic diseases characterized by progressive muscle weakness and loss of muscle mass, which ranges from mild to severe. There are 4 different types that I would like you to read about. This is caused by a defective gene. It is an inherited disorder. But 1/3 to 1/2 of the cases have no family history. So it's a newly acquired gene mutation in some of these cases. Do please read these over. Please pause it. Please go. I will include these on the lecture quiz just so that you have the information for the MBLEX. You are most likely not going to see this very often in your office. And there is not a lot of research that is out there. There's no evidence-informed massage recommendations. You definitely can apply massage to reduce pain and discomfort. And in many cases, heat is recommended as well as a pain relieving additive to the massage. But other than that, there is not a lot of evidence so far done in this. If this is something that you are interested in and you would like me to find some more information about muscular dystrophy and massage, I certainly can give it a go. But for now, we do not have a lot of touch therapy studies that I have been able to locate for you. Usually your clients, once they've hit a severe stage, will be in a wheelchair. So always follow recommendations for working with a client with mobility impairments. All right, that's all I have for you for today. Enjoy your evening, and I will see you guys tomorrow.